Lucille is a 47-year-old female who was diagnosed with primary multiple sclerosis with paraplegia 2 years ago. Upon her last exacerbation 2 months ago, Lucille was admitted to an inpatient rehabilitation unit and has recently been referred to outpatient occupational therapy OT services to return to her previous functional status. She plans to resume driving after she undergoes a pre-driving assessment. Lucille has expressed a desire to resume home care and to work. Lucille's primary occupational roles include those of a mother, wife, homemaker, and worker. Prior to her exacerbations, Lucille was independent in activities of daily living, not instrumental activities of daily living. Lucille considers herself a proud mother and a homemaker. Two of her daughters are in college and the youngest in the middle school. As a worker, Lucille owns and manages a garden center with her husband. Lucille resides with her husband and daughters in the suburbs. Her current resources include her family. At this time, her husband took a partial leave for 1 month to assist Lucille with appointments and transportation. Lucille's work at the garden center is only seasonal, allowing her much of the year to rest and dedicate to therapy. In reference to Lucille's current occupational status, Lucille is independent with her ADL with the use of adaptive equipment. However, she continues to have residual impairments in her dominant left hand. She is able to use her proximal upper extremity to stabilize objects and to attempt gripping, but often drops objects. At this time, Lucille is also able to ambulate independently with occasional use of a cane.
Hi, my name is Tatiana. I'm going to be your occupational therapist today. What's your name?
Lucille.
Hi, Lucille.
Hello.
How are you doing today?
Good, how are you?
And who came with you?
This is my husband. Jack.
How you doing? Hi, Jack. Well, I just want to ask you about your how you feel today.
Well, I'm having a lot of pain. Jaw aching, like cramping pain.
Can you
on my arm and hand, on my left
tell me
arm and
where?
hand.
Okay.
My hands, my wrists, my elbow.
Okay, so we're gonna start treatment now, and I'm gonna perform an ultrasound for you. It's called non-thermal ultrasound. So could you please, Jack, could you move? Okay. I'm gonna choose the parameters for you. Okay. Okay. You don't have to be afraid. You're not gonna feel anything. The temperature is not gonna be high. Okay. So you put the gel. Okay. Let's start the intensity. Take it away, please.
So this is going to help me with the pain?
Yeah, it's gonna decrease your pain. So it's kind of electrical current which goes through the transducer and converts to sound wave which penetrate inside your body and healing your tissue. Okay, now we're gonna do some massage. It's called retrograde massage to relieve the swelling in your hand. So you can watch this and just pay attention so you can do it for her at home. I'm gonna give you all home exercise program with exercises and the massage. So it's gonna be all explanation how you can help your wife at home. Okay? Okay, we have to put this in like this. Okay. So you always use a cream and lotion and ensure smooth gliding in comfort by decreased friction. With your hand elevated, gently massage your hand from long, slow strokes. Start at the fingers. Like this. And like this. Like you're pushing it the swelling down. Make sure you get all the fingers. Just try to. Okay. When you finish with all the fingers, you take it and you take down toward the wrist. And you can feel that the water is gonna go down. From the wrist, you're gonna continue to push it down towards the elbow. Make sure you have enough lotion. So if it's not enough lotion, just add it. And then from the elbow, you're gonna take it toward the shoulder. How do you feel?
Good.
Okay.
A little pain.
Okay. So make sure it's not really painful and just do it nice and gentle strokes. Okay, now I'm gonna fabricate a splint for you. It's called umbilical bar splint to reduce your spasticity in your hand.
Okay.
You are going to wear this at daytime and at night for a total of 23 hours. Okay? And it.
Can I take it off?
Yes, you can take it off when you're gonna do exercises and for hygiene.
Okay.
Also, in the future, I'm thinking to prescribe, if you're gonna have a residual hand impairment, I'm thinking of prescribing to a wrist splint, so it's gonna help you for your gardening. And now I'm gonna do the measurements of your hand. Okay. Okay, I'm gonna show you how to perform a range for your elbow and shoulder, just to prevent the future problems. Because I noticed that you garden your hand closer to your body. So I'm gonna do this. You're gonna move up and down. Okay, and also your shoulder.
Is it something that I could do at home with her?
Yes, you should do this just to prevent the future complications with the hand, with the arm, with the elbow, and the shoulder. Okay.
Can you do my hand?
No, you cannot do the hand now because it's you have a spasticity, so we're not ranging it right now.
Okay.
I'm gonna perform stretching
Okay.
for your hand and to loosen up your hand, right? So you can watch it closer, so you can perform this at home for your life before the all exercise that I'm gonna give it to you later. Okay, you're gonna distract the joint and gonna hold it from 5 to 10 seconds. Then you're gonna distract the joint again, you're gonna loosen up. Okay. And then you're gonna do all the fingers. Okay. After you finish the fingers, you can do the wrist. Then you can come with the elbow. and then you can do the shoulder. Okay, we just went over a couple of things that you're gonna perform at home, like arranging your elbow and shoulder and stretching. And I'm gonna show you also how to inhibit the tone in your hand. You can do these techniques every time you perform any task at home, during the cleaning or brushing your teeth, or grooming and everything else. So you're gonna put your hands on a surface and press it. Okay, so I want you to stretch your fingers like this and press down so your elbow is straight. Okay, you're gonna press it with all your weight, and for right now we're gonna do the gardening. I know that you really like this, right?
Yes, I do.
Okay, so you're gonna transfer the dirt from this pot to the other pot, and while doing this, make sure you press your hand with all of your weight. Okay, so let's do it like this. Very nice. I'm gonna hold it for you so you can. Okay. Do you feel the weight
Yes,
in your hand?
I do.
Okay, make sure the elbow is straight. Okay, you're doing great so far. I know you're not comfortable because it's not your dominant hand, but for right now we have to do it. Okay, very good. Well, at home, while you're gonna do this, and if you don't have anybody to assist you, I can cut a piece and Dyson for you, so it's gonna stay in place and it's not gonna move. Okay?
Okay.
So it's gonna help you a little bit. Okay, make sure the elbow is straight, and also we can use the clay pot, which is gonna be a little bit heavier than this plastic one. And later on, you can use your left hand. We can think of using the build-up handle for your gardening equipment. Also, we can use it with the brush or utensils you can eat with it, so it's gonna have like a wider grasp. Okay, for example, this is the small grasp and this is the bigger grasp. Okay, you can try this and water in your plant. Very good. Okay, I know fatigue is not a problem for you right now, but I want to introduce you to energy conservation technique, because you're compensating and overwork, and you're doing everything with your right hand, which is not dominant. Okay, I want you to split up task as you're doing something really big. Sit and rest. And here's the list of the things that you can do at home. Just alternate and incorporate short period to avoid the fatigues, and try to ask help when you need it.
Okay.